Hi, welcome to CORD. I'm Corinne Brinkerhoff, the CEO and Chairman of the Board. CORD is the Cape Organization for Rights of the Disabled. We have been around in the community for a very long time, since 1984, as a matter of fact. And what we do is we have been working to advance the independence, productivity, and integration of people with disabilities into mainstream society. What does that mean exactly? That means we do whatever we can to help you as a person with a disability to live as independently as possible in your community. Our community is Cape Cod and the islands of Nantucket and Martha's Vineyard. CORD is a Center for Independent Living. We are a 501c3 nonprofit organization. That means we have been recognized by the IRS as a charitable organization. We do not provide a fee for any of our program services. We serve people with any disability of any age and any income level. So you could be extremely wealthy, you could be living well below the poverty level. We will help you with anything you need to live more independently as it relates to your disability. Centers for Independent Living have things in common that make them Centers for Independent Living. One of those things is that they are private nonprofit organizations. We are not a state or a federal agency. We are federally recognized nonprofit organizations, as I mentioned. We are consumer controlled. That means people come to us for services. We do outreach activities. You may see us in the community, setting up tables, booths, other things like that to let you know about our services, but we do not call you, cold call you to try to get you to sign up for our services, so to speak. You choose us and you direct the services you want, and we assist you and support you in those services. We're community-based, which means we work locally. As I said earlier, we work within the Cape and Islands, and we are non-residential. We do not provide housing of any type. In fact, we are barred by statute from doing so. As a Center for Independent Living, we are run mainly by and for people with disabilities, and this means that at least 51% of our staff and 51% of our board must be people with disabilities. What we do is we create opportunities for independence, and we assist people to be as independent as they can, while recognizing that that will be different for different people. Being independent and independent living means having control over your own life and being able to control the decisions that you make and living your life to your fullest capabilities. And again, that is different for everyone. And people with disabilities have historically not been able to do that, as they've been locked away in facilities or been mandated to have caregivers. And the independent living puts that control back in your hands. We advocate for the availability of a range of service options to assist you to be as independent as possible. We have advocated on the local and national and state levels for accessible transportation. And here on the Cape, we have very good accessible transportation. Cape Cod Regional Transportation Authority is very good. We advocate for affordable, accessible housing, which is an ongoing issue. We know we keep fighting for that. And we advocate for accessible, affordable healthcare. Independent living is a hard concept for some people to understand, because we do like to, the society likes to take care of those that we see as vulnerable. But we are, as people with disabilities, in a lot of ways, in many ways, just like people without disabilities. And we have the right to try to do things just like everybody else, right? Just like people without disabilities. We have the right to try. And with that, we have the right to succeed in what we are attempting to do. We also have the right to fail. And this is a hard concept for people to understand. With that comes the right to try again. I haven't always been successful in everything I've attempted to do. I'm sure you haven't either, but I've tried again. A lot of people I know haven't always been successful in everything they've tried to do. They haven't been successful in every job. They've moved out of the house. They've had to move back in with their parents, whether they were younger or older. They've had to move back home. They've had to get another job. They've had to do a number of different things they did not anticipate having to do. Well, people with disabilities have those same issues too. They have the right to try. They have the right to succeed, just like everybody else. They have the right to not succeed. They have the right to try again. Just because you have a disability and you weren't successful in what you tried to do does not mean you do not have the right to try to do that again. In the medical community, that is often called dignity of risk and is more of an accepted thing in the medical community. In independent living or just in life in general, don't really have a name for it. Let's just call it independent living and say, we have the same rights as everybody else. Let's just try again. What is consumer control? Well, you as a core consumer, you come to us, you want to work on some goals. You are the consumer. You have control on what you want to do. You will decide who is going to be involved in your decision-making process. You will be provided with all of the necessary information support you need to make an informed decision on your goals. The information will be provided to you in a manner that is accessible to you. If you need your things in large print, we will give that to you. You need your information on an audio tape. Some of you may not know what an audio tape is. We will provide that to you. You need it in any sort of accessible format, we will provide that to you. You, as the core consumer, will be given choices regarding how you receive your services. You will set your own goals. Again, you have the right to try again. If you are not successful in achieving that goal the first time, guess what? You might not be successful in achieving that goal the second time. You want to try again? We will help you. This is what we call consumer control of your independent living services. The court was founded in 1984, and it was called the Cape Cod Project in Self-Advocacy. It was later renamed CORD. How did that happen? There was just a small group of people with disabilities who wanted to get around their community. They were going to stores, they couldn't get through the aisles, they couldn't reach the shelves, they couldn't get into other places they were trying to go to, just wanted to get around, get into local businesses. And they founded the Cape Cod Project in Self-Advocacy. It was later renamed Cape Organization for Folks who've been Disabled, what we now call CORD. We're now located at 765 Addicts Lane in Hyannis. Because of the pandemic, we're only open by appointment from 9 to 5 Monday through Friday. You cannot walk in and just receive services. The doors are locked. You will be asked to make an appointment. You may ask, do I even have a disability? How do I know if what I have is a disability? Well, a disability really is any continuing impairment, whether it be physical or mental, that is ongoing. So it might be cerebral palsy, a neurological impairment, something like epilepsy. You could have depression, an intellectual disability, a learning disability. Maybe it's Alzheimer's. Those are ongoing, continuing impairments that are disabilities. How do we know you have a disability when you come to court and ask for help? We don't require any proof of your disability. You just tell us that you have one, and that is good enough for us. Why is that good enough for us? But we're not giving you anything really tangible. We're not giving you money. We're not giving you a voucher. We're not giving you anything like that. What we're giving you is our expertise, our knowledge, our time. We are helping you be more independent, helping you fill out applications, find housing, get services. So because we're not giving you anything tangible like money or anything like that, we don't require any real proof. We trust in you. When you tell us you have a disability, that self-disclosure is really is all we need. Other programs and services will require some proof because you will be getting things from them. So if you want to go to Social Security or housing or something like that, you are going to need more proof of your disability. But for services from CORD, we do not require anything than you're telling us, your self-disclosure that you have a disability. We have a number of programs here at CORD that I am going to get into. We have, the names are not important though. I will touch on them. I will tell you what they are because you're going to hear them, but you don't have to know. Just come to CORD, tell us what you're looking for. We'll direct you to the right resource within our organization. You don't have to come in and say, I need vocational rehabilitation or I need options counseling. You come tell us, we know where you need to go and who you need to talk to. But for your information, because you will hear these terms, we have programs of independent living, vocational rehabilitation, which is part of our independent living program, options counseling, our transition to adulthood program, and our work readiness and preparation. So if you need help finding housing, we can help you fill out applications, get on housing lists, things like that. Very important. A lot of people need help navigating this sort of thing. We can help. You need assistance at work. You need help talking to your employer. Maybe you need reasonable accommodations to help you with your job functions. Maybe you need an adaptive keyboard, or you need to take more breaks because you have diabetes or something. You need to keep water at your workstation, things like that. We can help you navigate those conversations with your employers as they relate to your disability. Maybe you have a child with a disability and you want him to get a job. You're tired of looking at him around the house and you want him to get out and work. We can teach that child of yours soft skills for getting a job and for working. And we have a limited number of internships all the time. So we can talk to you about that and talk to your child. If he is in school, he or she is in school, we'd be happy to work on some employment skills with them and possibly get them an internship. Maybe you're living in a nursing home and you don't want to be there. We can help you get out. This is one of the core skills and services that we work on, is helping people who are in long-term care facilities and don't want to be there to get out. That's often where people are discharged to from the hospital and they end up there for a very long period of time because they don't have a safe place to move to. Housing resources are scarce. We will help you with that. Maybe you've heard of aids for daily living, like weighted utensils to help you with your opening jars or around the kitchen, or some lighted signalers and things like that for people who are deaf or hard of hearing. We can help you acquire aids for daily living at a low cost, possibly no cost if you need those to help you be more independent. You have a child in school who has an IEP. If you need help navigating an IEP meeting, an individualized education plan, and you don't feel supported in those meetings and you really feel like you need an advocate or somebody to help you through those or to support you in those, because those can be very intimidating with the school personnel, give us a call. We can help you through that. Again, if you or a loved one wants to move from a long-term care facility, such as a nursing home, back into the community, give us a call. We can help. If your child is ready to move from high school or adult services to college, give us a call. We will help with our transition services. We also love to do community events. I know that they have been scarce over the past couple of years, but we love job fairs, health fairs, any sort of community activity where we can set up a table and talk to the general public, where they can come up, grab our materials and have conversations with us about what we're doing. We love that. If you want a free workshop to your business, you're a business owner or manager and you want to talk about disability laws and regulations, we also love to do that. This is what we do. We do this for free. We will come in, we'll talk to you about how to work with your employees as well as your customers who have disabilities. If you want to see some low-tech items that can help you with your daily activities, such as opening jars, pulling on your socks, heating, weighted utensils and things like that, we're here. We have that. We specialize in low-tech. Technology is what it's called. We're here to help you with those things that people often don't think about as they struggle around their homes. If you run or own a business and you have some questions about whether or not your business is accessible, you want it to be, you're not sure it is, and you'd like us to come out and take a look at it, do some measurements, help you through that, we will navigate that with you, give you some advice and some information. And if you want to talk to your employees about reasonable accommodations and how to work with customers with disabilities, we can help. If you need help finding affordable, accessible housing, it's not easy to find on the Cape. It's not easy to find on the islands, but we can help. This is one of our big issues. It is an issue across the state. It's probably an issue across the country. It's definitely an issue on the Cape and Islands, but we can help. We will help you with your applications. We can help with your housing searches. We will guide you. We can't create the housing, obviously, but we will guide you through that. You just need help at your job and you're not quite sure what to do. You just don't know what to do. You're struggling because you are a person with a disability and you're just at a loss. Give us a call. We'll talk to you. Social Security is a big issue for a lot of people. The application itself can be very daunting. Give us a call. We will help you through that. You might have heard everybody gets denied. That's not exactly true. So we'll help you with the application, make sure you have everything you need. Come in, sit down, we'll do the application with you. It is long. It might be confusing to a lot of people. We'll help you. And if you do get denied, we can help you with the appeal. You don't need an attorney to do this. You'll see it commercials on the TV that say, hire us for your Social Security applications. You don't need that. We can help. At some point, you may need one. An attorney, but you don't to get this done and you don't for the appeal. So come in and let us help you with that. If you're working with the Massachusetts Rehabilitation Commission and you need additional services to help you with your goals, maybe you need to make sure you can, acquire some housing and some basic things first before you can think about getting a job, come see us. We'll help you with those independent living goals first, or at the same time consecutively while you're working with Mass Rehab. And we can push everything forward together. Somebody telling you that the nursing home is the best place for you, but you don't want to be there, give us a call. Maybe you're home and you really think you need to be in a nursing home, or you're not sure. You're not really sure what the best place and safest place is for you, give us a call. If you're over the age of 60, or you are a person with a disability over the age of 18, we'll help you figure all of this out. This is what we call options counseling. You don't really need to know that. Just give us a call. We'll help. If you have a child between the ages of 14 and 21, and you need to plan what's going to happen when special education services end, and you really don't know where to start with that, give us a call. There's a recurring theme here. Give us a call. We can help you figure that out. We'll also help your child between those ages 14 to 21 with social events. Do they have trouble making friends? Do they need more socialization in their lives? We can do things like we had a nice fun Halloween party. We have other social and recreational events that they can participate in. Do they need help with budgeting? Knowing their rights? Do they need to learn how to navigate the transportation system that I mentioned earlier, the CCA, accessible transportation? Do they maybe need to learn how to do things like call an Uber or a taxi or other things like that, just other life skills like that in order to get around? We help with that. Do they want just to talk to somebody else, or do you want them to talk to somebody else about, their goals and dreams and hopes for the future and how to set their goals? Again, the recurring theme of give us a call, we can help. This is what we call our transition to adulthood program, or TAP. And you don't need to know the names of these programs. Just call and tell us what you want. will set you in the right direction. For that same age group, we have what is called the Work Readiness and Preparation Program. And for those kids, those students that are interested in working, we can help prepare them for that. And we have classes on resume building, reasonable accommodations on the job, work safety, and other soft skills building, interviewing. And so we help prepare them to go out on the job. Right now, we have a limited number of internships that currently pay $15 an hour. So bring your job in to talk to us, and we can see if they are good candidates for this job skills training. It's actually soft skills. They learn their hard skills on the job, but bring them in and we can talk to them and see if they're appropriate in that program. We have a vaccine initiative we're working on, trying to make sure everybody is safe and healthy during the COVID-19 pandemic. If you are a person with a disability or you know one who has had trouble getting their vaccine, their initial vaccine or their booster, we want to help you. We can help you find a place to get it. There are more and more places to get it now. That shouldn't be difficult, but if you are having difficulty doing that, we can help. We can help you find the place to get it. We can help you get to your shot. So please call CORD if you are having trouble getting your vaccine or you know somebody with a disability on the Cape and Islands who is having trouble either finding a place to get their vaccine or actually getting to their vaccine. Vaccines save lives, and we want to help. We always need volunteers at CORD. For a number of reasons. If you want to help out in the office, we love to have you answer our phones and help out with office duties. And if you are a business owner or manager and you want to come talk to our students about starting out in work, if they've never had a job and you want to talk to them about potential avenues of employment and what it looks like to actually have a job and the responsibilities that go along with that, and what your particular line of work looks like, that would be great. And also, if you want to help out at fundraisers and other events, we welcome you to join our team. CORD has joined up with Elder Services of Cape Cod and the Islands, a well-known and well-established, wonderful organization in Venice. And we have formed the Aging and Disability Resource Consortium of Cape Cod and the Islands, which basically means that you can call us. And if what you really need is services from Elder Services, we will do a seamless transaction to get you over to their services, and vice versa. They will do the same to us. It's really a soft referral, and you don't have to worry about this telling you, oh, call Elder Services. We just have a partnership with them where we will facilitate an easy transition of services over to them, and they will do the same for us. It's called the wrong door. So if you have this call an organization that is not entirely appropriate, we will just make it seamless for you. If you do come to CORD, we do require that you wear a mask. I realize that the mandates have lifted a bit across the Commonwealth, but we are still requiring masks while we don't have 100% vaccination across the Commonwealth. We'll never achieve that, right? So while we don't have that, we do still require that people wear masks. And if you're feeling sick, we do ask you to schedule your appointment. We do have a journey magnifier in the office. If you have an appointment or you don't have an already scheduled appointment, you can make an appointment to use it. If you have low vision, you can come in and use this, and you can magnify your mail or anything you need to read, and you can have your use. We do have a scent-free environment, and for the safety and health of anybody who comes into the office, we ask that you refrain from wearing any scented products. So when you make your appointment, when you're coming in for your appointment, please do not wear any perfumes, scented soaps, scented deodorants. take care to have washed your clothes and unscented as much as you can, unscented, unbleached detergents. Don't put any lotions on, anything like that. It's really important as scented products have very detrimental effects on people, and the range can be quite broad. So for some people, it can be a headache. Other people, it can be seizures and respiratory shutdowns. So this isn't a minor request. This is actually quite important that we maintain the scent-free environment. We ask you to join our membership team. So please be a CORD member. It's open to anyone who supports the mission of the organization. And the mission is simply to advocate for the rights of people with disabilities and promote a barrier-free environment for all. Who wouldn't want to support that? A barrier-free environment for all. Dues is only $20 a year. And what do you get? Well, you get a reduced price admissions to all CORD events. We've made a tax-deductible donation to a great organization. And I can say that it's great. I have worked at this organization for literally half my life. It's been a long life, so half of it is a very long time. And you have the opportunity to be considered for service on the board of directors. I'm the chairman of the board. It's a great board. If you wanted to consider joining it, you could fill out an application and be considered as a potential board member if you are a dues paying member. If you need more information on CORD, we are located at 765 Pat's Lane in Hyannis. Our phone number is 508-775-8300. We also have an 800 number, 1-800-541-0282. Both of those numbers are voice and TTY. Our website is cordcapecod.org. You can find us on Facebook, Twitter, and Instagram. If you want to send us an email, please send it to cordinfo@cilcapecod.org. You can remember that by CIL, it's Center for Independent Living, capecod.org. Thank you very much for your time. I appreciate talking to you. I hope you have a great day, and I hope to see you soon at CORD.